Good morning, Rickey, Smiley. Good morning, Brat. Good morning, Eva. Good morning, Rock T, Special K, Gary with the T, and all the Rickey Smiley Morning Show listeners.
Man, I know it's got to be a
Morning.
glimmer of hope out there.
Yes, there is, Rickey. Again, overnight, things are changing on a day-to-day basis. So I heard you speaking earlier about they are going to offer home test kits to individuals. I just, state I would have to challenge the validity of that. The testing is relatively, accurate. The problem is the specimen containing. You really have to push that swab far up in your nose. And that's not pleasant at all, and you have to get enough of the mucus to get a viable DNA specimen. And so a lot of individuals, as soon as they start getting resistance, they won't push it any further. And so they might have it and just might not get a good specimen. So I would, advise individuals that if they can get tested by a medical professional, please do. But if it's not available and you can get access to a home test, and again, this is all, planned right now, but nobody's shipping kits as of today, then it would help. But, I also saw people, they were video on CNN of people doing drive-by testing, and they were swabbing people's mouth and throat. So it's hard and very difficult to get a good throat specimen. So when I saw that, I was like, half of those tests will probably be false negatives because they're not getting good specimens. So you really need to get a nasal swab if you're going to do that test. And there have been some treatment options that are being considered. They have now looked at several antiviral products by the Gilead company. One is called remdesivir, then there's favipiravir, and then there are the HIV drugs, Collier and Alluvia, which you see on commercials every 5 minutes now. All of those are being evaluated as possible good treatment options. But again, the thing that's getting everybody's attention now is convalescent plasma treatment. Convalescent plasma means someone got the disease, they got over it. That means their body should have great numbers of antibodies in there. So they take some of their blood, isolate the plasma, and then inject that into individuals or infuse it into individuals.
What?
And that should really give them, so they should give them like instant immunity to it and allow them to fight the virus very, very effectively. So that's not new. That technique has been used for a variety of things from infectious diseases to cancers. So that would be good, and it's something that's readily available now because we've had enough people that have had the disease and have gotten over it. The question is just, that process. You got to put people in the hospital. You can't just, that's not something you can just walk into a doctor's office and receive. So we're going to hope that process is vetted and they come up with a system that works for everybody. But they're going to be multifaceted treatment options. Again, most of the people in the hospitals that I work through, they're being treated. They're in ICU. They're getting a combination of chloroquine and azithromycin unless there's a contraindication not to use those drugs. So that's the primary therapy in addition to supportive therapy, which treats all the other symptoms, the cough, the fever, etc. So we had a good response yesterday, Rick. I got a lot of phone calls and a lot of posts and reaching out to emails, etc., asking about it once again. What were the things that you said that I need to have in my medicine cabinet? So once again, I want all the Rickey Smiley Morning listeners to get their pens and paper or just go and I sent that information. Then hopefully you'll be able to post it on the Rickey Smiley Morning Show website so individuals can see it. But those medications are, once again, Tylenol or Aleve, Mucinex DM, Claritin, Allegra, Zyrtec or Xyzal, those are non-sedating antihistamines. Cough syrup such as Delsum, which lasts 12 hours and is very good, particularly for a dry cough, or Robitussin DM, and then products like Airborne and Theraflu. And then remember the disinfectants that you use to clean all your surfaces. The 10% Clorox solution, hydrogen peroxide, and a 50-50 solution of peroxide and water. And then any soap solution, virtually anything from dishwater soap to a bar soap that you just shake up in a bottle of water. And then other products that are antibacterial and antiviral, such as Odoban and Lysol spray.